Hi, here's a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is systemic lupus erythematosus. What this disease is about? Actually, your body immune system attacks your own tissue and organ. There is a female predominance and it occurs in 90% of women than men. Lupus is an autoimmune disease, means what? Cell death releases nuclear antigen including DNA because B lymphocytes direct antibody against these cells, producing antigen-antibody complex. Sometimes the immune system can also attack red blood cells. We talk about type 2 hypersensitivity. On the other hand, type 3 hypersensitivity is when inflammation activates the complement. There are 11 criteria that mean to the diagnosis of lupus. The first one is malar rash. The second one is discoid rash. The third one is photosensitivity. The fourth one is mucosal ulcers. The fifth one is serosity, pleuritis, or pericarditis. The sixth one is Liebman-Sachs endocarditis. The sixth one is joint arthritis. The seventh one is kidney nephritis with herbicicast. The eighth one is brain psychosis or seizure. The ninth one is blood anemia, leukopenia, thrombocytopenia. The 10th one is anti-nuclear antibody. The test is very sensitive but not very specific. And the 11th one is other antibody. Let's see what are these other antibodies. Anti-Smith antibody, anti-DNA antibody, they are more specific for lupus. Antiphospholipid, usual target protein that bound to phospholipid. They are less specific for lupus. Anticardiolipid, remember there is possible false positive with syphilis. And the last one is anti-beta-2 glycoprotein. Remember, the beta fish let you to remember about anti-beta-2 glycoprotein. Anti-beta-2 glycoprotein. What about lupus and pregnancy? The fertility rate is normal, but there are spontaneous abortion. Antiphospholipid cause placenta infarction. Check with the newborn anti-RO. It's the best way to diagnose lupus with the newborn. What about antiphospholipid syndrome? There is hypercoagulability, increase in PTT, deep vein thrombosis, remember, femoral vein, popliteal vein, and there are thrombosis of hepatic vein, sushepatic vein, and portal vein. There is a stroke, and the treatment is lifelong anticoagulant therapy. Remember, sushepatic thrombosis, portal thrombosis. How to manage lupus? The first thing is to focus on prevention. Prevent severity by avoiding sunlight. there is some balance between flare-ups and remittance. To avoid flare-up, limit severity by corticosteroid, limit the immune response, but if symptoms are severe, use immunosuppressant. Let's recap. First one, malarage. Second one, discoidage. Third one, photosensitivity. Fourth one, mucosal ulcer. 5-1, pericarditis pleuritis. And Lippmann-Sachs endocarditis. 6-1 is joint arthritis. 7-1, kidney nephritis. 8, brain psychosis and seizure. 9, anemia, leukopenia, thrombocytopenia. 10, anti-nuclear antibody, very sensitive but not specific. And 11, other antibody. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the like button and subscribe? And see you for the next topic. Thank you.